Today on Heart of the Matter, I talk with Jim Carroll, Director of the White House Office of National Drug Control Policy, or better known as the ONDCP. His agency's mission is to stop the flow of illegal drugs in the United States and to connect those suffering from addiction with the tools they need to achieve recovery.
You are listening to Heart of the Matter, a podcast where addiction meets recovery and families find hope.
In 2019, we experienced record overdose deaths and are on track to set another grim record in 2020. Right now, our country is in the middle of a mental health and addiction crisis. That crisis is magnified by the COVID-19 pandemic. This is something Director Carroll knows all too well, as he's been traveling around the country, meeting with people in some of the hardest hit communities and leading discussions on the challenges they face. Today, we talk with Director Carroll about what he has seen, who he's talked to, and what the administration has done over the last 4 years and what needs to be done. Director Carroll, thanks so much for joining us on Heart of the Matter.
Thank you so much. It's great to be on the show and talking about this important issue.
It is so important, and I'm sure you've seen and heard in your discussions and talks with people around the country that it's gotten all the worse in the last few months with this pandemic. What have you been hearing?
Yeah, all of the preliminary data for 2020 shows that this is going in the wrong direction. And I think that you understand, you nailed it, that there's loneliness, there's sadness, and there's fear, which is being driven by COVID, which is understandable. I mean, there is a health concern going on, but especially for people who are in recovery and really who are newly in recovery, who are cut off from their support system, whether, it's going to meetings, whether it's going to see a peer, whether it's to seeing a professional, or we're losing their job. There's isolation going on, and they're not able or willing to get the help that they need. And sometimes, for valid concerns, the willingness, is driven sometimes by the fear of going in a facility where there's concern that COVID might be present. And that's one of the things that we're hearing, much like we've seen with nursing homes, with
Right.
COVID. There's some concern that if I go into a facility, am I going to get COVID? And so we've been working hard to make sure that those facilities are healthy. We need to make sure that we can get as many people in to treatment as who want to go in.
It's hard enough to get people into treatment. It's hard enough to find good treatment. It's hard enough to pay for good treatment. We'll get to that in a second. But during this pandemic, I can only imagine the logistical and health consequence nightmares of trying to find a treatment facility, get that loved one to a treatment facility safely. A lot of times you have to fly on an airplane to get there.
Right.
And then getting into a facility where you're going to be in close contact with other people during a pandemic.
Yeah, it's really scary. I mean, thankfully, the end of last year and just before COVID really hit, we launched a new website, findtreatment.gov. And it's a way for people to go online. It's completely anonymous. They just put in their zip code and they can find state license, which we know is so critical to make sure that they're getting top rate care. But they can find treatment centers in their area. There's drop down menus. If you have insurance, if you don't have insurance, if English is your preferred language, if you have another language, if there's a particular drug that you want to have primarily addressed. And so thankfully, that has been helpful. And I'm, so fortunate that we launched that, not even knowing that COVID was coming. But those are just types of the things that, we need to be able to do, until the health, of the pandemic is a little bit better, is to continue to just embrace people.
In the last 4 years, we've heard a lot of talk from the Trump administration about the fact that the opioid crisis is a public health emergency. And that's just addressing the opioid crisis. We're not, we're not including into that the alcohol addiction
Right.
crisis, other drugs addiction crises. What grade would you give yourself and the Trump administration when it comes to addressing addiction in America?
Well, first off, I think you're categorizing it correctly. It's not an opioid crisis per se. It really is an addiction crisis. And people might have a particular drug of choice, But for so many people, what they're really looking for, and you mentioned this in your book, is they're sometimes trying to treat themselves. They're trying to soothe themselves and get the help that they need. So I think we have to look across the board of what is happening on addiction issues.
Mm.
When I first took this job and first spoke to the president about it, he talked about his brother, Fred, who died of an addiction.
He did. He doesn't normally talk about that very much.
Yeah, he was pretty open with me, and we talked a lot about it. And he talked about, did we do everything that we were supposed? We, as a family, did we do what we were supposed to do? Did we find the right facility? Did we push him in the wrong direction? And I think these are the normal issues that families struggle with.
What did you say to him when he asked you those questions?
What I said to him is, those are the things that we need to address. And the main issue that I see is really stigma. That is one of the main things that we need to make sure that people understand, that addiction is not a moral failure. We've known for long before this administration that addiction is a disease, and we have to treat it like that. I think in reducing stigma, I really give us high marks on that. We've been very open about it. The First Lady has been very open about it. I have a family member in recovery. I'm very open about that. My family member has chosen not to go public, but in terms of this facing all of us, at the beginning of the administration, we used to say that 1 in 3 families identified as having an awareness of addiction. I think that number is in reality a lot higher.
I do too.
I think maybe at best 1 out of 2. And I think reality is we're probably closing almost every family either has someone in their family, a neighbor, a coworker who is struggling with this issue.
So I go back to my original question to you. What grade would you give President Trump and the Trump administration and yourself in this position when it comes to fighting addiction?
Boy, that's a tough question. I mean, obviously, I've enjoyed the complete access to the president on this issue. And the president has been very vocal on this issue. The president has met with our drug-free coalitions, our kids. He's met with the law enforcement that are trying to keep the drugs out of our communities. And I've been with the First Lady numerous times, going to hospitals and visiting mothers. I mean, I know this sounds, trite, that coming from a Trump appointee, I give the president an A on this issue. I really do. He's done more, I think, than anyone else. Obviously, I always strive to do more. And while we've had some great successes here, I always want to do the absolute best I can. And so maybe I'll give myself a B, and with the idea that, there are more things that I want us as Americans to accomplish going forward.
I'm going to push back a little bit on giving President Trump an A.
Sure.
Many people, while they welcomed the fact that this administration and President Trump there has been a lot more talk from this administration about the issue of addiction, but there hasn't been the funding to back up a lot of these initiatives. Your critics say that you've done nothing more than tinker around the edges. You have not backed up these great, bold statements with the amount of funding necessary to actually address the lack of quality science-based addiction treatment in this country, access to it, and the ability to pay for it. And on top of it all, the president has pushed to overturn the Affordable Care Act, which was the one thing that really helped a lot of families pay for good treatment.
We certainly have fought for every dollar that Congress will give us on this issue. And with almost $36 billion going to this issue, it's more money than Congress has ever appropriated before. Certainly we could use more money, and I'm very fiscally conservative, but I'll be the first one to say this issue needs more money, and we've been working with Congress to make sure that we get it.
Why can't that happen? This is a disease that costs this country more than $500 billion every year, and yet we're only giving 36 billion. Yes, you got more money. You did manage to get more money out of Congress than previous administrations have gotten. It's still a tiny fraction of what experts say we need.
I think part of it just goes to your point of making sure that we're using appropriate science and appropriate technology, that there wants to be efficient government spending. We want to make sure that we're spending it in the right direction and not just throwing money at things that are not based in science and going towards methods and solutions that don't work. I think that's part of it. I also think that people don't understand quite yet about how this impacts so many families. With 70,000 plus Americans dying a year, there's a lot of families that have been impacted. There's so many families that have been impacted just by death, that if there more families are coming forward to talk about this, that I think there'll be even more funding. In terms of the ACA, the overturning ACA is part of the president's goal to make sure that individuals have the right to choose their own health care. It's not to deprive them of care. It's to allow individuals to pick their own. But I certainly think that that's, one of the reasons that the findtreatment.gov website that we launched, it's helping people who don't have insurance get the help that they need. It's making sure that communities understand that they need to invest in their citizens, that they must be willing to open treatment centers. Sometimes there's that thing of, not in my backyard, NIMBY. Everyone likes the idea of getting more people into treatment. But when you go into some of these neighborhoods, they're like, well, I want more treatment centers, but I don't want it next door to my house. And the reality is we need to explain to them, it's just like having, someone who is coming out from diabetes or someone who's recovering from cancer, to have a house next to them. And so I think part of it is just sort of understanding, exactly what, needs to be done to help these people.
We know that fewer than 20% of people who need help get it.
Right.
We know that actually sometimes less than 10% of the help that people are getting is science-based medicine. Why are those numbers so low? I
think part of it is stigma. And again, that issue if they don't want to come forward and not willing to even admit to themselves that they need help. People suffer with that the family who love them and who surround them, their friends, their coworkers might say, look, it's obvious that, someone needs help. It's obvious that, we need to get them to treatment, but they're resistant. They don't want to admit to themselves. Also, I think part of it is they don't want to admit to their employer because they're concerned about the repercussions of saying, I need to take a break. I need to go get help for myself.
Why isn't there anything in place to force employers to treat addiction like any other medical disease? We do know that there are employers who say, especially if an employee relapses, you're out of here. There seem to be no legal protections or, remedies for that.
Thankfully there are some state remedies in some of the states that do it.
Right, but the federal government needs to set the tone for this, doesn't it?
Yeah, Congress needs to, could absolutely pass a law that would require it. And the good thing is that at least health insurance under the parity laws should be covering it. They're not perfect by any stretch, Elizabeth. I don't want to kid you and say the insurance companies have all stepped up to the plate on parity.
Far from it. They fall short. They second guess, they slow walk it. They refuse to cover anything beyond 2 weeks. There are countless examples of insurance companies refusing to pay for science-based treatment.
Yeah, I hosted a parity event at the White House about 18 months ago and invited the insurance companies to come. We had speakers, we had people who were in recovery talking about it. And there were some insurance companies there that really have done the right thing, and we wanted to highlight them. And the sadness is we're having to highlight them for doing the legal, what the law requires them to do. But also it's my complete belief that it's their moral responsibility to do it as well. That, if you, have a religious background or, rely on your faith for part of it, I don't see how you could look yourself in the mirror and not say, I want to make sure that we get the help to everyone who needs it. And so, we've been pushing for this, been pushing for parity to actually be enforced and pushing for people to get the help that they need.
So if you mentioned that it's up to Congress to allocate more funding to this, what you have termed a public health emergency. Even the Obama administration Surgeon General, right before Obama left office, and that Surgeon General left office, declared this a public health crisis. Why hasn't Congress allocated more money to this public health crisis that costs our nation hundreds of billions of dollars every year? What did you ask for? Was it a lot more than what they gave?
Well, at a hearing, I had a good discussion with Congressman Cummings. God rest his soul, a champion on this issue. And I was asked the question, this was actually after his death, but he had put forward a bill he and I had a conversation about money, and then later he put forth a bill that was, I think it was in the range of about $100 billion. And I was asked the question, is that the right amount of money? And my response then is the same one that it is to you, which is, I don't know the right amount of money, but I know that we need to spend more.
So given all your efforts, why are the numbers still so low? Why do still fewer than 20% get treatment and actually fewer than 10%, get the treatment that is truly medically appropriate?
Yeah, I don't think all of it comes down to money. I do think some of it comes down to stigma, where people want to come forward and say, I need help. I think some of it is coming down to the prevention message, that we're still not reaching our kids the way we want to. We spend a record amount of time and effort teaching a prevention message, having an education campaign targeted at kids who are 18 and under. And we had really good market penetration there. That's one of the things, obviously, you understand, given your line of work, is the ability to reach kids. But we need to keep up that drumbeat. And that's true this year, and it's going to be true next year. Regardless of who is president, it's got to keep up the message of making sure the kids understand the dangers of the drugs that are out there and how easily addictive they are. This is not the drugs that we grew up with, and the dangers are very real. And so we need to make sure that we're doing everything we can.
But when it comes to people already suffering from addiction and finding appropriate help, why is that so difficult for people to do? I mean, one of the criticisms of the rehab industry, so to speak, is how unregulated it is. I mean, there are many rehabs out there that are nothing more than mills, body factories, as they're sometimes called. People come in and out, and it's a great money-making venture for them. Why is it so unregulated?
Well, that's why we launched the website of findtreatment.gov, to make sure that people could find state licensed facilities across the country. I think it's about 25,000 that are now registered across the country.
But what goes into that? I mean, when something is, quote, state licensed, who goes in there to inspect what they're doing and how they're doing it?
The state health departments do. And this is, one of the gold standards, of looking at this, is to make sure that they're using evidence-based in there. For people with opioids, one of the most effective treatments we know is medication-assisted treatment. And so, if it's a facility that really specializes in opioids, and addiction to opioids, it's looking at that to see if that's one of the things that they have available. It's that type of looking at it that I think is really going to be helpful. But there's also some really good organizations, sort of like, the Better Business Bureau is an independent government, independent of the government, but a national, examination of businesses to see how they're doing. And there's a couple of companies or entities that are starting that up as well. And look, so when especially a parent or, a loved one who is looking for help, for someone in their family, they're panicked, they're, going onto search engines and they're typing in addiction help, and they come up with all sorts of, the immediate responses are not always the ones that are the best.
No, they're usually not. It's not, the first 20, entries on that, rehab, rehab near me, or best rehab for anxiety and alcoholism, or best rehab for opioids. It's all usually places that aren't using proper medically based science to treat addiction and aren't as reputable.
Yeah, and that's why we're trying to find at least state licensed until there are some of these other groups that are coming together, and they're usually recovery groups who are there's two separate ones I think now that are working to come up with a national registry of ones that will actually do the best and use the latest information that's possible.
I'm curious. The General Accountability Office says that while the president did do a great thing by declaring this a public health emergency, that has led to almost, according to the GAO, almost nothing in terms of progress when it comes to the fight. Defend that.
Yeah, I absolutely think that that's wrong. I mean, I know firsthand that it is. We know that there's been a reduction in the number of Americans that are dying. We know that prevention is up, and the number of drug-free community programs where we're teaching are up. As I talked about, we know that first-time drug use in these areas have been reduced. We're pushing that age of initiation older and older. We made sure that naloxone, the life-saving drug for an overdose of an opioid, that those are up over 400%. That's a remarkable achievement right there. The prescriptions for dangerous painkillers, opioids, the president set a goal of a 1/3 reduction by the end of the first term. We've already exceeded that. We're about 35 or 36% reduction in the number of opioid prescriptions. We've been able to seize more methamphetamine. Some of the meth that's now coming into our country from the southwest border is at record highs. We don't talk much about the northern border, but I was in Michigan about 2 weeks ago because they had just announced a record of a 1,700% increase in drugs being seized coming down from Canada.
Wait, 1,700% increase?
Over 1 year.
What kinds of drugs?
Everything from opioids, meth, and marijuana, illegal marijuana, illicitly grown and bringing down. And so, I mean,
and who's moving those drugs across the northern borders now?
Cartels, just like coming up from the southern. It's the same sort of, these traffickers. And, we have to remember the traffickers, these are not people who have an addiction, to a drug. The true traffickers are the ones that have an addiction to greed. They don't care. They know that they're leaving just a wake of destruction, and they do not care. It's very clear that there are lots of situations where an individual is sharing a drug with someone else and they both have an addiction. We've spent a remarkable amount of money, and more money than ever before, in starting drug courts across the country to make sure that there are fewer and fewer people even becoming incarcerated at all in the first place. And of course, with the criminal justice reform that was led by Jared Kushner and passed, that is one of the ways that we're making sure that there are fewer and fewer people who are being convicted of low-level, nonviolent offenses, especially when they're related to addiction, where it's either possession of a drug or a small misdemeanor offense, where we're keeping them out of the criminal justice system, keeping them out of that lifelong penalty of having to check the box to say that I was convicted, of an offense. And so those are some of the successes that we've been able to have. And so while I appreciate what GAO writes about, they're not out there on the front lines like I am every single day. And they don't have the awareness of what's going on, quite frankly, like I do in talking to these people.
No, but the statistics still remain what they are, which is that, drug and alcohol addiction kills more people every year than gun violence, car crashes, and HIV/AIDS ever did.
Yeah.
The numbers are going up. We still have a dramatically low percentage of people who can find and afford appropriate treatment. All those things remain. While you've been able to, as they say, tinker around the edges and make incremental improvements, do you really feel like you've been able to make any lasting change? The statistics say no.
Yeah, I mean, I do think that we have made great progress. If this was an easy answer, this would have been solved years, maybe decades ago. But this is not an easy answer. It really isn't. There's so many things that lead to addiction. And one of it, I know that you've spoken very openly about, is the need to make sure that people can find mental health treatment so that they can get appropriate medical treatment as opposed to turning to self-treatment. I do think part of this, and one thing that we've been pushing for, is to make sure that mental health treatment is addressed in our society. And again, this goes back partly to the parity.
I was going to say, how are you going, you just referenced having at the White House a bunch of insurance companies who were all patted on the head for basically doing what they're supposed to do. The fact remains that most families cannot find and definitely cannot afford proper treatment for either mental health issues and definitely not for addiction.
Yeah, and that's, that is why some of the, we're pushing to make sure that some of these reform efforts, including the reform of this part of the ACA, could go to have families, allow them to have the choosing and have the financial resources to do it themselves. And part of this is also going to have to be a recognition that this issue deserves more time, attention, and financial resources. We know this in so many families, that if we had identified the mental health issue early on and addressed it, that the people would not try to self-medicate and self-treat themselves with a drug of whatever the choice is, whether it's alcohol or something else. And one of the really groundbreaking things that I think has happened over the last few years, and I'm not saying that we're leading the effort on it, I'm not taking full responsibility for it, but we've been pushing the importance of it, is having schools and having pediatricians and having caretakers look at kids with high ACE scores, the adverse childhood experiences. There are some kids out there that we really know from science are going to be more susceptible to going down this because they've had an adverse childhood situation. Maybe it's, a parent who's been incarcerated. Maybe it's a parent who has been abusive, a parent who has their own addiction issues. It's having those adverse childhood experiences. If we can identify those kids early on and really just encircle them with resources and help to make sure that they don't go down this path.
I'm curious, why aren't more doctors and nurses, but doctors especially, in medical school trained on addiction? It's incredible how little time is spent in medical school on this incredibly important issue that is now a pandemic in this country of its own sort.
We've been able to make great headway on that. And 2 years ago, I spoke, back when we could have in-person meetings, in-person conferences, I spoke at the National Association of American Medical Colleges and pleaded with them to teach addiction directly in med schools, some of the core classes. And there are some med schools that are doing that. They're spending as much time talking about addiction, the dangers of overprescribing, and the recognition.
How to recognize the signs.
Yes, absolutely.
How to ask the questions, because patients often, there's a joke among doctors that when they ask a patient, how much do you drink every day, that you should then double it. Nobody's going to go in and say, I'm drinking a bottle of wine every night. They'll say, oh, I have a couple glasses.
Right. Well, and that's just, and we've also had the conversation though, in medical school about, so we talked about overprescribing, the dangers and recognition of addiction, but also the realization that there are patients in their waiting room that are already having addiction issues. And in talking to some doctors, and this is something that has come up repeatedly just in the last 6 months and 9 months of COVID, of the patients they're seeing, and doctors who are like, oh, I'm not really specialized in treating addiction, and I don't see those type of patients. News alert, they actually are. They're already in their waiting rooms and they're not coming forward. And, it used to be that doctors, never talked about sex, right? With the kids came in, and the pediatricians, would, gently, through some of the programs that came up, started talking to the kids, are you sexually active? What we've been pushing.
Here's the HPV vaccine.
Yes, exactly.
Exactly.
Is starting having those conversations as well. And one of the things that we've been talking about here is an annual physical. We were talking about, having kids, and every year before your kids start school, they have to have, or most schools, I think you have to have an annual physical, is making that part of the annual physical. So it's not between the student and the school. It is between the student and the doctor, or the student and their family. Is, are you experimenting? And I really, this day and age, I hate the word experimenting because one pill can kill, as you know. But are you using some of these substances? Are you trying this? And having that part of the standard exam and standard conversation.
You've also said that making sure that rehab centers are reputable and using science-based medicine to help their patients is something that's up to the states and state regulators. Why can't the federal government take a role in that?
Yeah, I think the federal government can set the gold standard, but I think in
Has
terms
it?
of, yeah, absolutely. Like with opioids, and knowing that medication-assisted treatment is the gold standard for helping people with that. So we can set the guidelines for what it is, but the states are the ones who actually go in and regulate this. But you're absolutely right. Elizabeth, one thing I have to say though before I go much farther is some of the things that have been some of the most beautiful parts of my job has been going to recovery high schools. And there's several recovery high schools around the country. And the reason I bring this up is I just went to one. And it's these schools that are set up to support high schoolers who are in recovery. So they're in an environment with other students who are also in recovery. A lot of the times the teachers are in recovery. It's sending kids the specialized help that they need. And having attended some of these recovery high schools, and last year being the graduation speaker at a graduation high school, and there were only about 9 kids, but there are some remarkable stories of recovery that are out there. Yours too.
Thank you.
And I think, we have to recognize that while, there are some really sad, people out there that have not been able to find help, I don't want people to lose hope. That recovery is real. Recovery happens, and it's possible. And you might stumble along the way, and it might be a little bit of a difficult journey, but I don't want people to lose hope. And I know you don't either. And I want to make sure that while we're talking about some of these issues, that we also are giving hope to people and hope to their families that recovery works, that recovery is possible. And so I think that's also important for us to note.
Where is this high school?
The one that I saw was Wisconsin. The one I did a graduation speech last year was Minnesota. And then we did the ribbon cutting of one in Pennsylvania that opened up last year. And so there's a handful of them around.
What do you wish you could have accomplished during your time with the Trump administration and in your position?
It would be the unrealistic but always desirable goal to have no overdose. I mean, that is the one thing, is to have no overdoses and have no fatalities.
We're so far away from that.
We're so far away from that. But that has to be the guiding principle. When I wrote the National Drug Control Strategy for the president, it was with one goal in mind, and that is saving lives. None of the other metrics really matter quite as much as that, because that is the one defining thing. And so if there's one overdose, that's one too many. And that's always going to be my objective, regardless of where I sit. It's to achieve a point of where people get the help that they need and to get the help that they can live. That's going to always be my driving principle.
We are speaking just days after President Trump appears to have lost his bid for re-election. Do you have any hope of staying on in a Biden administration in this position, or do you expect to be replaced?
I expect to continue to work in this field regardless of what happens. I really believe I found my life's job. I found my mission of trying to be out there. I'm blessed having a family member that is now 3 years into recovery from a dependence. I know there's too many families that don't have a story of success. I've met too many of them. And what I want to do is to make sure that the club of parents who have lost a child, it gets smaller and smaller every year. And this is what I want to continue to do. And Elizabeth, I really appreciate what you have done of raising awareness of this issue and decreasing stigma. You've done a remarkable job of making sure that we can work on this issue. This is a bipartisan issue. And heck, I don't even think it's bipartisan. I think it's nonpartisan, right?
Totally. It affects everybody from every economic strata, from every educational level, rural, urban, north, south, east, west. It affects everybody in this country. And even if it doesn't directly affect you, just the dollar cost of this addiction crisis in this country is enormously expensive, which is why it's disheartening that still thus far relatively little has been spent when it's costing us so much. And that's just the dollars. We're not taking into the enormous grief, that it costs so many millions and millions and millions of families.
Yeah, I mean, it's painful. It is so painful. I had the honor of meeting with 15 single parents who had lost a child about a month ago. And you talk to them, and if there's anyone, in the country that feels like, oh, we're spending too much money, go talk to these parents and realize that as a parent, you would do anything in the world. You would spend any amount of money to make sure that your child doesn't go down that path. And so that's where I'm going to continue to fight to do, is to make sure that that club of parents who have lost a loved one is smaller and smaller and smaller.
Director Carroll, thank you so much for talking with us today. We appreciate it. And
thank you.
Good luck in the next couple months you have left. You can still do work, good work, but we appreciate your taking time with us today.
Thank you, Elizabeth.
And that's Heart of the Matter for today. You can find this podcast on Apple Podcasts, Spotify, and our website at drugfree.org/podcast. And as a reminder, if you need help with a loved one who is struggling with substance abuse, you can text 55753 or visit drugfree.org. Talk to you soon.